Hello everyone. Today in this week 13 of PBN, we will learn about international patient safety goals with me, Mrs. Septa Mariana. You also have received the briefing from Silom nurses about PPI in week 9. Please learn that material. I will include the material for our final exam. In this topic, I hope you can learn and understand about the goals of the International Patient Safety Goals, specific risks to safety with respect to developmental age, improve the health of a safe environment, nurses' role in maintaining security, strategies to improve client security, explain the client risk of falling, and the last one is identification tools to assess a person's risk of falling. There are seven outcomes we need to mastering in the end of this topic. Please pay attention and learn digitally. The International Patient Safety Goals was developed by Joint Commission International. This organization is located in United States that accredits medical services from around the world. Siloam also accredited by GCI. International Patient Safety Goals is aiming to ensure quality and safety standard of patients focused healthcare services. With these standards, patients will receive high quality of health services by all healthcare professionals. These standards also significantly impact on patient outcome. Can you imagine yourself as a patient in the hospital? What will be the risk or danger that can be happen to you? There are a lot of danger will happen to you. What is that? The hospital associated infections. Yes, related that the patient got infections due to admit to the hospital. Hospital full of pathogens that can be spread the infectious disease to the patients. The second is operating related. Patient may be experience wrong site of location, wrong tools, and the others thing. Medications related can be happen because of wrong identification or wrong doses. These three adverse events is the most happen in the hospital. So the IPSG goals is to absence the preventable harm to a patient during the process of healthcare and reductions harm associated with healthcare to acceptable minimum. The IPSG was developed by GCI in 2006. There are three versions of the standards until today. Please search and read what is the differences between IPGSG in year 2006, 2011, and today. IPSG has six goals to prevent harm or danger to the patient in the hospital. They are identify patient correctly, improve effective communications, improve the safety of high alert medication, ensure safe surgery, reduce the risk of healthcare associated infections, and the last, reduce the risk of patient harm resulting from falls. The first goal, identify patient correctly, is the highest and the most important goals. When we deliver any healthcare services, we must use at least two patient identifications, namely full name and date of birth. When we take any lab sample from the patients, we must labeling the sample in front of the patients. And the last one, for newborn baby, we can use different identification using baby's name, medical registrations, and mother's name. Please watch the video to get full information about first goal of IPGSK. Second goals, improve effective communications. Where there is an important result of the patient, we must use SBAR method. Please review SBAR communication in communication course. The second method is handover communication must deliver clearly between healthcare professionals. Please watch the video for further information. The third goal is improve the safety of high alert medications. Please give a concern when administer a medication that has look alike, sound alike medication. For example, Losec, omeprazole, and Lasix, furosemide. I repeat again, Losec, omeprazole, and Lasix, furosemide. It is a medication look alike, sound alike. The second is use safe method for concentrated electrolytes. For example, KCl. Please see the video for further information. The fourth goal is ensure safe surgery. Can you imagine how if you have surgery and the healthcare professionals do in the wrong location? It will give a huge loss for the patients. Therefore, before surgery, healthcare professional must perform time out in the beginning and sign out in the end of the surgery. Please watch the video. The fifth goal is reduce the risk of healthcare association infections. Like I said before, hospital is the source of many infections. We must identify what is the risk of infections that can be appear and how to cope with that. Please see the video. The last goal is reduce the risk of patient harm resulting from falls. Many patients, especially elderly patients, can experience falls. So, the risk of falls must be reduced with intervention that related to it. Please see the video. All the video in every goals have different information with what I say. Please write down what is the difference with what I have said and submit it to Learn. You can type it and send it at least in this Friday at 4 p.m. The second learning outcomes, we will learn about special risk to safety related to developmental age. For children, the risk of danger can be happen because of they have a small body that they cannot do many activities like an adult. They still in developing stage, so their cognitive is not mature to take any decision of their life. Many hospitals also do not have facility for children and their safety. Hospitals also do not have any guidelines for pediatric, so many healthcare professionals may wrong in giving any intervention to the children, such as wrong dose and many things. In hospitals, many elderly patients experience delirium. The elderly tend to have many diseases, so they involve many health workers, specialist doctors. Due to many diseases, there are drug interaction with other drugs. Besides the possibility of giving the wrong drug, the elderly have a high risk of falling due to frailty. Elderly tend to experience poor nutrition due to decreased function of digestive system, easily affected by pneumonia acquired due to cross contamination in the hospitals. So, what we can do to reduce any risk of danger to the patient in the hospitals? There are elements that can improve the health or safety environments, including waste management, noise management, infection control, radiation safety, general building safety, water quality, heating, ventilations, and air conditioning. Waste management is crucial to promote high quality of healthcare and safe environment within hospitals. Medical waste is any waste occurring as a result of medical services and scientific research in medicine. World Health Organizations or WHO divides medical waste into seven basic categories based on their properties and risk levels. The first one, infectious waste, pathological waste, sharp, chemical, pharmaceuticals, genotoxic waste, and radioactive waste. In this scheme for waste management in the hospitals, please see and learn it by yourself. Hospitals have various sources of noise such as alarms, paging systems, telephones, computers, printers, televisions, delivery carts, staff conversations, equipment, housekeeping activities, air conditioning system, door opening and closing, and sound system. Of course, one physical effect of the noise is human stress, which should be avoided in hospital environment. Hospitals should measure the noise level periodically to reduce patient exposure to such noises. Infection control provides a framework for identification of a hazard and development of an action plan to eliminate the hazard or minimize its effect through control measures. Control has been achieved by recognizing the means of growth, reproduction, and transmission of pathogenic microorganisms. The main components of an effective infection control program is a standard precautions and additional precautions. For standard precaution, including hand washing, use of personal protective equipment, appropriate handling of patient care equipment, prevention of needle stick injuries, environmental cleaning, and appropriate handling waste. The additional precaution including airborne precaution, droplet precaution, and contact precaution. The radiation is danger for human that can affect living cells and damage genetic materials or DNA. To minimize radiation danger, we must concern at three things, including the time of exposure to the radiations, the distance, and the shielding we use. Safety of building is the practice of designing, constructing, operating, maintaining, and removing building in ways that give no one deteriorated health, injuries, or death due to of the building. Hazard can be reduced by doing the following. 1. Establishing a traffic flow pattern. Ensuring clean, dry, unobstructed, and slip-resistant surfaces, maintaining railings and stair surfaces in good conditions, supervising patients to minimize unnecessary drift. HVAC systems is designed to meet specific values of temperature, relative humidity, and air change frequency with different areas in hospitals based on standards of design. For example, high-risk areas such as operating rooms and intensive care units require special ventilation system through filtration system. Example, HEPA filters, and pressure relationship to adjacent area. In general, clean atmosphere reduce the risk of airborne infections and dangerous of gas explosions. Water is a strategic energy resource that should be used and managed properly. In hospitals, water is a necessary utility which is obtained from outside sources. This utility may serve a medium from the spread of infection from outside sources to the hospitals. Things to do is water storage must be cleaned and checked regularly. Water used in the hospital must go through deionizations, distillations, and sterilizations processes. So, what is nurses' role in patient safety? Nurses play a critical important role in ensuring patient safety while providing care directly to patient 24 hours. This is the nurse's role for IPSG. Goals including observation including to avoid errors, infections, complications, and more. Communicate. Communicate with other healthcare professionals and as the advocates to avoid error communications. Educate patient to adhere the treatment of plan. What is nurses' responsibility? Nurses must inform patient and family of potential risk. Report adverse events to the appropriate authorities promptly. Take an active role in assessing the safety and quality of care. Improve communication with patients and other healthcare professionals. Advocate for positive practice environments, and promote rigorous infection prevention and control programs. This is 5 strategies to improve client security. The first one, nurture a patient safety focused culture. One of the best patient safety improvement strategy is to foster a culture that focuses heavily in improving patient care. You can see the same here and find out what the hierarchy can be done to patient safety culture. The institutions give reward, support, goals, and standard to all employees. These regulations must be applied to all systems, organization, department, and unit. Second, identify and work on mistakes. What what's better is identifying the issue before they happen and preventing them. For instance, there are different solutions available that can help identify potential issues and address them effectively. In the case of mistakes that already took place, identifying why they occur and coming up with the strategies can be prevent the future occurrence is the tried and test solutions. The third one, reduce chance for human error. For instance, if paper is used for recording medicine administrations, handwriting, or common names lead to mix-ups, leading to an adverse impact on healthcare outcomes. On the other hand, if digital solutions are used, then not only will it speed the process, but it also make more reliable and safe, especially if patient photos are used for identification. The fourth is ensure a clean environment and enforce hygiene rules. A clean hospital environment is essential to reduce hospital acquired infections. Patients and healthcare workers must avoid the risk of infection that exists in the hospital. The use of PPI is also important for health workers. One of the topmost patient safety goals for many years have been improving the accuracy of patient identifications. And according to the Joint Commissions, it will once again be the number one goal for 2022. This just shows how important accurate pattern identification is for patient safety improvement. Next learning outcome, we will learn about fall risks. Can you tell me why patients have high risk of fall? What happened in the hospital? Or what can increase the risk of fall in the hospital? Falls are a common but dangerous occurrence in hospitals, especially among elderly patients. Falls occur in average 3 until 5 per 1,000 patients per a day worldwide, totaling 700 to 1 million per year. 1 per 3 hospital falls result in injuries including fractures and head trauma. All falls will lengthen the stay in the hospital and increase costs. There are three categories of falls. One, anticipated psychological falls. Fall caused by age, illness, medication, procedure, predictable examinations can use falls causes 78 of falls. An anticipated psychological falls, falls causes by psychological cannot be predicted. 3. Falls due to accidents. Falls due to the hazardous environment conditions. More medication or 4 taken will increase the risk of falls. Use of benzodiazepine increases the risk of fall by 44%. Diseases that increase the risk of falls, including vascular disease, arthritis, thyroid, diabetes, depression, COPD, vertigo, and dementia. Please watch the video to understand more about education to prevent falls in the patients. There are 7 things to do to prevent falls in the hospitalized patients. First, fall risk identification. Every patient that admitted to the hospital must be assessed. Many tools to assess fall risk, but the two more widely used scales are the Morse Fall Scale and the St. Thomas Risk Assessment Tool in falling. The MVS or Morse Fall Scales is a quick and easy method to assessing a patient's likelihood of falling and the most widely used scale in terms of risk assessment. This is the English version of MVS. There are 6 items need to be evaluated in a patient to calculate their fall risk. 3 levels category of fall risk including no risk, low risk, and high risk. This is the Indonesian version of MVS. This is the study case about fall. Please read and count the score of the MVS. Write down your answer and you can merge with the previous homework that I said in the previous slide. Please do by yourself, but you also can discuss with your friend. The next thing is alarm. The alarm is used to alert nurses to assist patients when when they need help, such as rising from the bed and moving. Sitters also benefit to prevent falls in patients. Sitters provide full supervision to a patient with a high risk of falling. Having patient sitters is very effective but expensive. As a nurse, we must educate patients to prevent fall. Patient education is potentially effective in reducing hospital falls for certain patients. It is not suitable for patients with cognitive impairment. Environmental modifications are very important to reduce the risk of falls. Consider the type of flooring, lighting, object around the patient, and others. Physical restraints is the last resort to prevent falls. This option is still controversial as physical restraint deprives the patient of dignity and autonomy. So, when you want to use restraint, please ask your team and your doctor. The last one is using non-slip socks. Non-slip socks provide additional traction to prevent patient fall. This is the references of our topic. Please read more and learn more. That's the end of our presentation. Thank you for your attention and I will see you in the in person. Thank you.